I am Director Amy Vogel. I've been in Mankato for 30 years, starting next month. I've been an officer here 30 years. I came here fresh from college, and I was an undercover drug task force agent. So I spent my first 2 years working undercover buying drugs in and around the Mankato area, legally. I was buying, but they were illegal drugs. And then I moved over into the patrol division in Mankato, and I spent really the largest portion of my career in patrol. So I was a patrol officer and then became a patrol commander. I stayed in that position for a number of years, and then I moved on and I became deputy director. So we'll get into explaining all these funny titles as we talk a little bit in the organization. And now, for the past 2 years, just over 2 years, I've been director of public safety. So today we're going to be talking about community policing. I'm going to have Matt introduce himself and give some of his background, and then I'll explain about our department and how it's a department of public safety, and then we will go into some conversation on community policing.
As Amy said, my name is Matt DeRose, and I'm currently the Deputy Director of Public Safety. Much like Amy, I've been here almost 30 years. I came down for school and attended, at the time, Mankato State University. I got my bachelor's degree and then stuck around here. I'm originally from the Twin Cities area. Had all the intention of the world of going back home and being a police officer somewhere up in the metro. And here I am 21 years later, and I don't have any intentions or plans on going anywhere. So I've been with the department for about, I'm in my 21st year now. Actually, my 22nd year. And so I spent about 8 years in patrol. I've supervised in investigations and administration, and for the last 9 or so months, I've been the deputy director. So somewhat following in Amy's footsteps here, and taking care of public safety. So we're excited. I'm excited to be here and engage with you. Hold the microphone up a little bit higher for you so you can hear. But engage with you, provided you some handouts. Actually, all the information on the handout is from our newly designed and newly released website. The city produced an update to the city's website, and as a part of that, public safety, as Amy or I will probably talk a little bit about, is a transparency hub or a dashboard for public safety that's really kind of new and innovative, certainly for our area, but really across public safety across the country. Just giving some more data, some better information about public safety, how we operate, the things that we do, and the things that we're looking forward to in our community. So all of that information can be found on our website, but we'll talk more about that as we get through.
Okay, so we're talking about Department of Public Safety. What does that mean? Does anybody know what it means here in Mankato? It's different in a lot of places.
Police and fire.
You're exactly right. However, our first line personnel, our firefighters and police officers, retain their role. They do not switch back and forth. Some places, very few places you'll see that happen. But all our administration is the same. So we might, Matt supervises a fire commander. So we mix it up. So it's kind of different that way of how we do it. And what we look at is we look at our operations side. If you think of that as you make the 911 call, those are all our operations. And then we have another side that we call strategic response. And that's all those things that supplement patrol and fire suppression. So that's your investigations, your hazardous threat responses, training function, throw a couple more at me, Matt. Code enforcement, all those kind of things. So it kind of got those two sides of how we handle things, and there are firefighters and police officers on both sides of the house. Public safety, if any of you remember, became an issue that the voters actually decided in 1985. At that time, it was put on a referendum if Mankato wanted to have a public safety department. It was the vision of Bill Bassett at the time he wanted to have some cost savings. He also envisioned a way to even be able to eliminate some overtime by having a joint response and some of those kind of things. So we became a Department of Public Safety. So that is 55 sworn police officers and 18 full-time firefighters. Our firefighters are a combination though. So we have full-time firefighters. We have what's called paid on call. These are the people who sit home and might be watching TV and are assigned to be on call that night, and the call goes out and they got it on their phone, they get the page and they respond right out there. We have residents, which is something a lot of departments don't have. So the fire station up by campus, we call that fire station number 3. And the fire station up by Augusta, by the Quick Trip, way over there, is fire station number 2. Number 2 has townhomes built on it. And so we have 3 people who live in those townhomes who are firefighters, and they will respond to calls for service 10 nights of the month. They can get in the fire truck, they can go to medicals, they can do whatever. So 10 nights of the month, there's 3 of them, so that covers a whole shift. And they will respond. At Fire 3, that's our dormitory style living. Typically college kids, that's where a lot of our recruits come from. Just because they're looking to get into something. We do a lot of recruitment there. And they love the bonus of living for free. So, because that's what they have to do. They do have to do a little bit of yard work though, which sometimes we have to get on them about. They're not always great about that. Do you have anything to add, Matt, or?
No, I think it was, you kind of touched on it a little bit, when we talk about the fire station 2 and 3 and having residents and having people living in the townhomes, we've hired 3 firefighters over the last several months here, we'll say, just to use them as an example. They all came up through those ranks, whether they were a paid on-call firefighter, maybe they were a part-time firefighter. Part-time firefighters are experienced, they may work in a small town around Mankato or somewhere else, but they come and they staff for us and help supplement and work right alongside the full-time staff and the paid on-call staff. And so we're able to use that in the fire service really as a kind of a feeder system to full-time employment. It helps with recruitment, it helps with the application processes and the hiring processes and things like that, which in government can tend to get a little bit lengthy and take a little bit of time, but if we have those people that we're cultivating in-house, it shortens things up and gives us a great opportunity to see them as an employee leading up to full-time employment. We're currently working on that with full-time police as well. We have community service officers that we're working and training and bringing them right aboard as full-time police officers as well. So again, we get to look at them for a couple of years before we hire them full-time, which is something that benefits not only us as an organization, but really the community when we can hire people that need less training, they're already in tune with the community and the community's needs, and are willing to really jump on to the philosophy that we have that we're going to talk a lot more about here.
Does anybody have any questions at this time about public safety or how it works? Mr. Friends.
How would you talked about the staffing, but how does the workload compare both on the fire and police side to say 10 years ago? I don't know if you measure that in terms of calls or hours, but can you give us a perspective on how much busier or less busy
Sure.
the work is?
I would say when you look at the fire service, they have done a fantastic job at prevention. And we've really made that our goal here. So we do commercial inspections and we do rental inspections to make sure all those fire code things are being addressed. So fires over the decades have definitely gone down, which is fantastic because that's what we want to do, right? Police calls have gone up. Now, the interesting part of that is there's 2 things, is we take calls for service that might be somebody left their garbage can out or there's loud noise. Those aren't necessarily crimes. Those are what we just call calls for service. So they have gone up dramatically. However, as much as we're growing, crime is really pretty stagnant, which to us is great because, if it was going up just with the population, that would be somewhat understandable, but we are staying stagnant here while our population is exploding. So, this year is kind of our new trial year though, after 2020. We had literally no calls for service in 2020. It was very, very quiet with all the bars closed and all that. And our medicals, people didn't want to go to the hospital and they felt like they didn't want to bother the hospital when they knew there was other people in need. So we had a very, very quiet year last year, which was a good year to kind of allow us to make some structural changes like I talked about a little bit earlier.
Thank you.
Mike?
I know a lot of people would say, well, the calls are generated by the colleges in town. I'm wondering if you wanted to talk about that as far as both those who do the crimes or the calls and the time of day, perhaps, for some of those.
Sure, we're an unusual city for our call load. We have one of the longest peak times of any city. We hit a peak at about 3 o'clock in the afternoon. And then it goes down a little bit, and then of course, at bar close, or around midnight, it can skyrocket again. So we have that long time period we have to cover. So that's I lost where I was going. Well, say that again, Mike?
Long peak time, college students.
Oh yeah, so college students, yes, sorry. I got distracted. College students, I'm not gonna say college students cause the calls for service, but I will say that we know and studies prove that 18 to 24-year-olds are much more likely to be a victim, a witness, or a suspect. Now, imagine our community. Do we have more than a higher amount of 18 to 24-year-olds than other communities? Absolutely. So while I don't blame it on the college students or say these people are responsible for this directly, we just have a little bit different population that shows up a little bit differently.
Thank you.
I used to live on Cedar Street, so at about 2:20 on a night owl, I'd be reading, and I could hear, the college kids coming up the hill to go back to their dorm. And all I could think is they are more of a danger to themselves than they are to anyone else.
Absolutely, absolutely, and if you, it's tragic when at night the officers are driving up Warren Street Hill or driving up Bell M, and how many single women you can see out there. And a lot of times you can tell there's people who are very impaired, people who step out in traffic. It is a very dangerous situation and that's one of the reasons why you'll always see the police cars too. Is really checking that area, making sure everybody's safe and everybody's, whether they have a ride or somebody with them to get home. In the winter, we find people there all the time. And that's a stumble, with our winters, that could turn tragic very quickly. Okay, we'll move on to talk a little bit about community policing, but before that, I'm going to go back in history, because this is really where the roots of community policing occurred. This is not a new thing. A lot of people thought it was new in the 90s. It wasn't new in the 90s. It actually goes back to the United Kingdom. And it was the first time somebody was trying to found a modern police force. That person's name was Sir Robert Peel. He was prime minister for a couple terms, but he really was known for what he brought up and what are termed the 9 Peelian principles. And those principles that he set up back in the 1800s are still incredibly pertinent today. One of the things that he always talked about was policing by consent. Is we police by the consent of our community, and that consent means we have a general consensus of what police need to look like in our community. He also said the police are the public and the public are the police. The police are the only ones who are paid to do the job that is incumbent for all of us to do. So with that mindset, he created what we're called the Bow Street Runners. Interesting fact, if you ever wonder where the term bobbies came from, Sir Robert Peel, they were called bobbies after him. Just a little tidbit that I find interesting. But with this, and he talked about policing by consent, but he also talked about legitimacy. And that is so critical, and you hear it all the time now, is build trust and legitimacy, build trust and legitimacy. And he was talking back about it in the 1800s. Law enforcement went through a number of things. Back in the 1800s when they did it, they were trying to get rid of the military to create a civilian force. And then we have gone through eras of professional policing, the traditional model of policing, and everybody keeps returning back to the community policing. It goes out of fashion for a little while, but it always comes back. And if you remember the Norman Rockwell picture with the big officer sitting on like a soda fountain stool with a little boy with a backpack or his knapsack next to him, that's community policing. So that's the picture that I want you all to see when we talk about community policing. So I'm going to move on to just kind of some of the philosophy behind it, and then I'm going to let Matt speak for a little bit. So really the philosophy of community policing, built off what Sir Robert Peel and his principles, is 3 things. That's outreach, that's problem solving, and that's partnerships. That's how we police with consent. If we don't have those 3 things, we're not gonna get the outcomes that we need and build the connections. So we really heavily focus on that. Outreach like this, you'll see us at night to unite, but you'll see the officers and squads at night just get out to talk to a group of kids in the park. We believe it's really important because that's where we learn what we need to be doing to satisfy the public. Partnerships, we have incredible partnerships. I noted many years ago, the partnership between CADA, which is our domestic abuse shelter, and the police department. And there was these grants in the metro area about, oh, here's how you can make a relationship with that. And I'm like, we've been doing that for 10 years. And this is like first occurring to somebody up there, you know, so we have, it's the magic of being the size we are. We know each other, we know people. We are great partners with MSU. We had an officer that was assigned to MSU. Unfortunately, the budget cuts with COVID, that was a position that was cut. Matt and I actually go up quite a bit and talk to the diversity, what is it called? Diversity and inclusion group. So we have a lot of those types of meetings. MCHS, that's the Mayo Clinic. And I can't even, I mean, there's a lot of other partners we have that we only get our jobs done because of each other. That it's not, you know, you're kind of doing this and I'm kind of doing this. We have a lot of overlap. That's how we get the job done and get it done right. And now I'll give it to Matt. We can talk some more about community policing.
So there's a lot of different ways that we could do community policing, a lot of different ways that a city, a county, a jurisdiction could do community policing. But the way that we do it here in the city of Mankato is we break up the city into about, it's like 29 neighborhoods, right around 29 or 30 geographical neighborhoods. They're pretty small. They might only be 8 or 10 square blocks or square-ish blocks, because we don't have a whole lot of square blocks around here. But 29 or 30 neighborhoods that are part of 5 different districts. So the districts follow similar to a political word. So if you think about the five council members in their districts, but they don't follow exactly along, but right around there, and then maybe use some natural boundaries to help us decide the neighborhood that the officer should belong to. So if we have 5 districts, 29 neighborhoods, and then we also have a couple of specialty groups. Refugees and immigrants is a specialty group, and then senior citizens is also a specialty group. MSU was, we still do lots of engagement, and that's a neighborhood in and of itself, but that had been called out specifically for our geographical and our neighborhood assignments. So we have our patrol officers who fluctuate 31 to 33, 34, 29, or so. Each one of those officers is assigned to one of those neighborhoods or to the group, the specialty groups. And they come to those neighborhoods, they get assigned early on. And as they're going through their 16-week training to become a police officer here in the city of Mankato, they're assigned to that neighborhood. So they get to know not only the entire city, but they're really getting focused in on their neighborhood. I'll fast forward to the end of their training, they do what's called a neighborhood portfolio exercise. And they talk all about their neighborhood. So if there's business, if there's residential, some of the problems that they've identified within that neighborhood, the people that they've met, anything that someone would want to know about their neighborhood. So they're really specializing in that small geographical area. Each officer will do, we want them to be out of their cars doing foot patrols. We want them doing calls for service review, so we can look through our records management. We can look on maps. If I go off shift for 2 or 3 days and I come back for my tour of 3 or 4 days on, I can pull up a map, I can pull up our records management, and I can say, all right, within my neighborhood, there were this many calls for service. Maybe there was a burglary, maybe there's some suspicious activity going on, something that was reported. I can see what happened on my off time, and then I can really pay attention and focus on that during my days on. I can then go out to the community, I can knock on doors, I can go to the people that I know in my neighborhood, and really engage with them and talk about those problems and talk about those calls for service that occurred. We want the officers to do foot patrols. We want them to check if there's, we have them check and do some compliance checks on gambling enforcement. There's 24-ish, 25-ish charitable gambling sites in the city, pull tabs, so they'll go in and they'll do bar checks. We do have a neighborhood officer who is assigned to the downtown entertainment district, and that covers really just the bar area, the entertainment area, but they're out engaging with bar staff at night, the bouncers, management, owners, things like that. and really working at problem solving within that small core area. They typically need a lot of help with that just because of the amount of calls for service and the things that are needed within that area. But we have one officer that's assigned there. On Thursday, Friday, Saturday nights, you'll see officers, not just those neighborhood officers, or that neighborhood officer, but you'll see other officers doing foot patrols down there with them to help out as well. We have some officers and a civilian investigator who specialize in doing engagement with the retail group. So if you think of Madison Avenue and you think of some of those retail stores that might have loss prevention, Shields, Walmart, Target, Fleet Farm, places like that, and really work at engaging with them and identifying trends. Are there particular people that are responsible for a number of the shopliftings? Is there a particular item that's being shoplifted? I mean, how can we actually problem solve this instead of just going up and writing a ticket and moving on to the next call for service? So we do have some specialty assignments that we have. Our detectives will work within those neighborhoods and help out, but they really tend to focus on the retail, some of the human trafficking, and then we also have drug task force agents, and there are 2 school resource officers that specialize within their schools at East and West and Central as well. So that's the philosophy that we have, that we could have an officer assigned to a geographical area. We really want them to own that neighborhood, and we want them to be able to make decisions. Not all decisions, sometimes decisions need to be brought forward through the chain of command, but really we trust our employees, we feel that we train them properly, we give them the tools that they need, then to be able to make some of those decisions, and do some really good, meaningful problem solving within those neighborhoods, and really engage, as Amy said, we're working with the community. Throughout the course of my career, we've always done this, but really every year and every opportunity that we get, we really try to increase that engagement, and what can we do differently today than we did yesterday. And when I started 20 years ago, we didn't have neighborhood assignments, but yet we still did community policing, just not to the level that we do it today. And so to be able to have those neighborhood assignments, and then the districts are overseen by a supervisor, by a sergeant, who can then work with their team if there are things that they need to identify within their district. But an officer won't come to work that day for their 10 or 12 hour shift and just spend that 10 or 12 hour shift within that neighborhood. They're still gonna be responsible for going out and handling calls for service throughout the city wherever they're assigned for that shift. But if they hear a call go out in their neighborhood, they will more than likely, jump on the radio and say, hey, I'll take that. I know the complainant, or I know what's going on over there. It's part of a bigger issue. So again, we want them to be very in tune with their neighborhood, and really the only way to do that is to get out and really get to know the citizens, the residents, the visitors, the business owners within that neighborhood itself. So sometimes it's a challenge if you're working 9 p.m. to 7 a.m., unless you have night owls that are up reading late at night. But a lot of the times if the officers are working overnights, it's a little bit more challenging. The good news is that we have some really good dedicated staff that if there's problems that are occurring during the day, they may flip their schedule a little bit, they'll adjust, they'll come in, they'll find help. Again, if they're not able to take care of it on a 9 to 7 shift, maybe one of their partners is working day shift and they can kind of trade off. If I'm working day shift and Amy's working night shift, and the problem in Amy's neighborhood is a daytime problem and the problem in my neighborhood is a nighttime problem, we may say, high five, let's trade problems here and we'll take care of it. We're not gonna shy away from a problem just simply because of a schedule. If the community is in need of some problem solving and want to problem solve with us, we'll make every accommodation that we can to get out there and make sure that we do that. Are there any questions about the neighborhood assignments that we have? Mike?
Do you have, I would assume, special relationships with the neighborhood groups that are out there?
Yes, so the neighborhood associations in particular, it's a little bit higher of a partnership with them. That's also involving the community development staff who oversee the neighborhood associations. But typically that's gonna mean monthly meetings, every other month, quarterly meetings. Those formalized neighborhood associations that bring their residents in together, there's quite a bit more engagement with those groups. And not every neighborhood has one, but we've had interest over time with maybe some formal organization. We really wanna try to shy away from formally organized over a specific topic. But yet, whatever it takes to get neighbors together, we're willing to do our part and be able to do that. So, again, we'll work with community development. A lot of times our problem solving involves community development, and they're the ones that do the planning, they do the zoning, Those are things that aren't necessarily in the wheelhouse of public safety. We know about it, we don't know, much about it. But then public safety and public works or engineering often work together to be able to solve problems as well. So we really look to go across the city organization as a whole and spread out that problem solving all across the organization.
What's your policy on cell phones and driving, hands-free?
So the city policy or just in general?
Everything.
So can't text and drive, can't make those phone calls and drive. Unless there's an emergency, we always encourage people to be as safe as they possibly can when driving. So sometimes that might mean pulling over to make that call, sometimes it might mean waiting to make that call. But
Even hands-free?
well, hands-free is okay. So a lot of cars come today with Bluetooth, which is a fantastic piece of technology to be able to do that. But we know and recognize that there is some of that still happening in the community. And those are things that officers can see when they're driving around and they can make a traffic stop. They can do some enforcement, they can do some education, whatever the situation would dictate. Or we do get 911 calls. We get a lot of driving complaint calls because we just can't be on every block, every moment of every day. And oftentimes citizens see a lot of concerning driving behavior that they feel that they want to report to us, and then gives us an opportunity to find those drivers and make sure that we're educating and enforcing as much as we can. Yes, Mike?
Once a newspaper reporter, always a newspaper reporter. What are the formal and maybe informal relationships that the department has with human service providers, those who might be able to be called in in a certain situation as opposed to a police officer?
So we're blessed here in the city of Mankato and in this region with the resources that we have available to us. And just as much as we can't do our work and our problem solving without the community and the residents themselves, there's a lot that we can't do without human services. There's a lot that we can't do without other social service type agencies. The hospital would be another example. Amy mentioned CADA. The list of partnerships and groups that we rely on for services is just exponential. And one of the core tenets of our training program for our officers is about problem solving and really about getting people recognizing we can't solve every problem that we're called to, but we should have an idea of who can help. And oftentimes that means a call to a social service agency. It might mean a call to a mobile crisis team that we have in the city. It might mean transport to the hospital. It might mean, fill in the blank of social service type agency that can be used to help solve that problem, because we can't. And so oftentimes we're that first call, we're the easiest phone number to remember. And so we'll respond, but yet we also have that list of resources that we can call, and at the drop of a hat, they are there to help us out. Maybe they respond with us, we can refer somebody through a report. There's a lot of different mechanisms that we have in place to be able to work. And over time, simply forwarding a report has now come to daily meetings with child protection. It has come to weekly meetings with human services, quarterly meetings through the court system with court administration and public defenders, prosecutors, the jail, probation, and really identifying those ways that that groups can come together and do a better job at really communicating what our role is and finding out who can better take the lead on some of the problems that the community faces in order to really problem solve them on a long-term basis.
Some years ago, you had what you called the Mankato Citizens Academy, and I think about 20 of us signed up and learned a lot of things that were very interesting. And I had a ride along with Officer Jessica Ellis once on an overnight, which was quite interesting. But there weren't very many upheavals that evening. But anyway, are you planning to do something like that again? Because I thought it was a real eye-opener for those of us who signed up.
So we have talked about bringing back the Citizens Academy. I think that there was some real big interest last year, and then COVID. So we didn't get an opportunity, but there's also some interest potentially at the city level and not making it specific to public safety, but how can we do this across the city organization? And, you know, one day might be police, the next day might be wastewater, the next day might be IT. But we do always wanna try to find ways that we can engage more. In October, we have the fire open house, so we open up the doors of the apparatus bay at the public safety center, and people can come in and look at all the fire trucks and all the equipment, and kids can paint and draw pictures and all that sort of stuff as a part of fire safety. But how do we continue to build on that, and really bring people into our facility, learn about what we do, how they play a role in the things that we do, and really help answer some of those questions. We're an absolute open book and as transparent as we possibly can. There's not really much that we hide. And so we have offered ride-alongs in the past, we've offered Citizens Academy in the past, and some of those things, and we just have to find the right time and the right place to be able to do those again.
It was such a wide spectrum, and I missed only the one that the detectives presented, and I was really interested in that, and I just had to be somewhere else. But, you know, the thing was, you didn't have to do any of this, you could go to the classroom presentation, and then I didn't get into a fire suit. I didn't get tased, and, I didn't rappel down the side of the building. Although there was someone in each of our groups, and, you know, each of those activities, someone did.
Yeah, I think there's always gonna be someone to raise their hand to go down the pole at the fire station, maybe rappel down a building, and for some reason, there's always someone willing to get tased or pepper sprayed.
You mentioned transparency. I think it's no secret that 2020 was a year of challenging times when it comes to policing in our state. How do you guys work to remain as transparent as possible? Because I think that consent with community policing often stems from people feeling like they're part of everything going on with that transparency.
Right, so we have been trying to be transparent for a number of years, realizing that we are the public. The information we collect is not ours, it's theirs. So for a number of years, we have tried it. You know, it was an opportunity to make some major changes right after George Floyd. And so one of the things we did was we took all kinds of our data, so our policy manual, complaint forms, our neighborhood officers, and our crime stats, and we put that all on the internet. It used to be buried in a page and a page and a page, and now it's all right out there. We call it our transparency hub, because we think that's where the information should be. And we're not afraid to take a look at ourselves. If somebody files a complaint on us, that's what we need to do, and we will look at it and we will be accountable to whatever decision is made. So some of those things that people have really wanted to and asked for, unfortunately, the transparency page is not yet done. We still have to find some ways to make some information or statistics easily digestible for the public, like how race intersects with crime and our arrest rate and those kind of things. We do have an advisory committee, which is 9 citizens, and they advise us on things that they would want to see, how they would want to see it. They're very protective of us in some ways, and you know, they ask, just put it out there, make sure you explain it, and it's the community's data. So we will put it out there, and we will be accountable to whatever that ends up showing.
Is that nine-person group multicultural?
Yes, it is. So that's 9 people, and they represent the 5 wards, again, that we talked about. And 1 from the business community, 1 from the nonprofit community, I get 7. 1 from educational, and there might be just an at-large person. And we try and keep that group very diverse. It's difficult. We're not as diverse of a community, so we have to reach out and find people in different ways, because we want this group as diverse in race or in age or you know, the backgrounds or anything, because as a group then we make better decisions, right? The more diverse we are. So yes, so that group is diverse. We can continue to work on that. But we have some good starts. We have people from the YWCA on there, and some other groups like that. So, and we also have a city councilman is also a liaison on that group, so he comes to the meetings, we meet every other month. So,
Who is that?
who is the council member? Dennis Deacon, sorry, council member Deacon. So, and they're open to the public. So if somebody was interested in seeing what it was, is you go to the city's webpage and you'll find, it'll publish the dates and locations, and anybody can come. Some people have came and just watched, some people have asked to participate on specific issues, so, we invite the public to come, and it's also a good way for us to recruit new members, so. Okay, so you've heard us talking a lot about problem solving, but we haven't told you how we solve problems. So we use a acronym called SARA, S-A-R-A, and SARA is a way which we work through problem solving. There's many different models of problem solving, but this is the one that we use. So the first thing we do when we go out and we see a problem, say we have a house that's vacant, some kids have left stuff there after parties, there might be vagrants living in there, all those kind of things. We look at a problem and we say, first of all, who are our stakeholders? Anybody who has any issue with this? Neighbors, landlords, the homeless population, kids that are partying, obviously us. We'll go with that. And so we look at all those people and say, all of us need to solve this problem or have some input into this problem. So we go to that first S in SARA, and that's scan. And that's where we really take a look at what is the problem here, all ways around it, 360, what are all the problems here, and let's gather that information. So if it was a one-time occurrence, it's a one-time occurrence, but it's happened 5 times with different groups, are we including everybody? And then we take that information, we analyze it. Okay, so we take a step back from the problem itself and say, do we have a problem with homelessness in our community? Yes, we do. Okay, can we get a hold of a group that could go out and reach out to them? Can we reach out somehow? Or we look at maybe some juvenile kids. Do they have a playground they can go play at? Do they have access to other things? So that's where we analyze the data and we look for that bigger picture issue, not the symptom, but the big picture issue. And then we come up with a response. So we might say we're gonna have a playground or advertise a fire open house to give kids something to do. We might work with the Salvation Army to give vouchers to people who need a place to stay, and work through all kinds of those issues. So we would go to the landlord and say, you know, let's clean up your property so it doesn't look like this so people don't take advantage of it. So that's where we respond. And then we always go into assessment is our last thing. We always go, is our response working? Because some problems, we go, this response worked great here, and what looks like the same problem, we try that response and it doesn't work at all. So we have to go and do the assessment. Is it getting better? Are things changing? So that's kind of the model we use, and you can hear that from the problem solving and outreach and partnerships to do all that. Is like I said, that's the kind of the 3 points of the triangle in community policing. Does anybody have any questions? This is really, Matt and I are pretty wrapped up. We are excited about next time, because next time you're going to hear about like super specific things that we are doing here. I almost asked Matt today to talk about the Yellow Line project, but that was spoiled for next time. So, so come back and hear about the Yellow Line project. It's like revolutionary. He's traveling around the country giving speeches on it, and it's just something that started as an idea here. So we'll be excited to hear that and some of the other things that we do. But we're still here for any questions that anybody has or.
Other than the post-bar audience downtown, what would you consider the biggest problem for police in Mankato?
I would say that we are starting to see more and more opioid use and opioid overdoses. In the last year or so, we've had 5 or 6 overdose deaths in our community. One is one too many, and so that's part of that SARA model and really scanning what's the issue here and who can we engage with. A couple weeks ago, we did a media event where we had some family members that came and spoke. We've got some other social service agencies and partners that spoke to that, just to raise awareness, that there's, medication available in the community for families and for users, to help offset those effects and try to prevent a death and save a life, right? We're seeing more and more mental health related calls for service and chemical dependency related calls for service. But that's where the blessing comes in, that we have a lot of those services and resources available to us. The local mobile health or mobile crisis team covers 10 counties. And so today, if I need them here in this room to come out and help with something, they actually might be in Northfield. And so that says that they're busy. They're a good resource to have if Rice County is calling them or Albert Lee. But we also have brick and mortar crisis center here in our community that we could bring somebody to the facility and get the same, if not a better level of care to resolve that call for service. But there are just a lot of those services that are available. And so we look at alcohol use, and it is not necessarily specific to the college students, but that age group, as Amy had referenced, 18 to 24, we do have just about every drug that you could think of in Mankato or around Mankato. And so just really working through those calls for service and that problem solving is probably, although the quantity of calls related to that is probably lower than maybe shoplifters, I would say the importance and the priority of working through those is much greater than a shoplifter or a theft from vehicle. Both very important to us, but a theft from vehicle is not costing somebody their life, it's not costing somebody their job, it's not costing relationships. And so we really gotta work through as a community, because that's gonna need a community response more than just about anything that we've ever dealt with.
Opiates, excuse me, is there a particular part of the population that's across all?
No, it is across the board, and there's not a typical drug user. You can't close your eyes today and picture what you think is the typical drug user, because you'll be wrong. It's everybody. It's young kids getting their hands on mom and dad's leftover prescriptions. It's young kids getting into mom and dad's alcohol, or then trying marijuana, and then trying something else, and then somebody has meth at a party, and then you try heroin, and then that's not enough, so we're actually going to ask for fentanyl. And so it's just that ever increasing danger to the people that are using.
It starts young, you think?
Oftentimes it does, but then I think we didn't necessarily analyze it here in our community, but there's a lot of studies that looked throughout the course of the pandemic, and what did the pandemic do to mental health, and what did it do to chemical health? And it was awful. Mental and chemical health were already in danger. We were already dealing with that, but the pandemic just made it worse. People were isolating, they lost jobs, they lost relationships, and so they turned to those chemicals, to those substances, in order to make it through the pandemic, which then also aids in suffering more mental health as well.
You had a question?
Oh, yeah, I just wondered that, police station used to be down on Front Street, right? And now that's the public safety, is that the public safety place, or what?
That's the public safety place, yes.
Okay.
So that used to be called the Law Enforcement Center, and if you remember way back, probation was there. The sheriff's office was there, and the jail was there on third floor.
Right.
Now I got the corner office on third floor, so figure out what that means. It was the max hold jail cell. And so what we did with that is we completely redid the building, but we decided to co-locate our office with the fire station. As we talk about sharing those resources and sharing that response, what better way to do it when we work in the same building? Firefighters and officers work right there together. So the part you see on Riverfront is the apparatus bay, or where we keep the big fire trucks. And then inside, everybody's all mixed up together. So it's something that the idea didn't go over very well. A lot of people were very hesitant about it. Nobody wants to change it now. We really enjoy working together, and we find it's just so much, we have such a more of a robust response when we work as one department. Yes, sir.
You talked about the number of calls, and I'm sort of getting the impression that the crime rate, if we can use that term, is not really changing here in Mankato over the last decade. I'm in the ballpark with that, right?
You're in the ballpark.
We have all these conversations at the state level about race and about policing. Do either one of you want to say anything about what you see locally? If you recommend changes for us at the state level, what are they? If you think we're doing great here, which I always say, I get more emails about my kids' football pants don't fit than I do about any complaints about local law enforcement. And I guess I wouldn't be doing my job not to say, what are the issues, if any, that you see locally about race and policing?
And that's a whole lot of question to answer.
Come back in 2 sessions for that.
We do have disproportionate numbers in arrests and race. There are a number of factors that can play into that. Do we have systems that do not benefit people of color? Yes, we have systems, whether it's in the police department or just our city structure, the community. So yes, we do have those issues that we need to dismantle one by one, and it has to be a proactive attack on that. We also have a criminal justice system that disproportionately treats people of race a little harsher. So imagine, as a 16-year-old, you're driving a car, and an officer stops you. Your parents might work an afternoon shift into a night shift. They might be a lower income family. So you don't tell your parents, right? You keep that secret because you think, oh, if I just don't do it, it'll go away. Well, when that 16-year-old is a person of color and they're in a situation where they may be in poverty, is that one thing can blossom into something completely different and turn a person who was speeding literally into a criminal. So if they don't pay their ticket, the state goes ahead and suspends their license, right? They might not know, so they're driving around, they get stopped by an officer. Officer says, hey, you're driving after revocation, you can't drive. Now you're getting a misdemeanor citation, okay? Now guess what? They lose their insurance, because they can't afford the insurance, and now they don't show up for court on that misdemeanor. Then what happens? We arrest them, and we put them in jail. And you gotta think back to that original offense is so minor, but it can explode like that, and our criminal justice system really does that as disproportionate the outcomes. What a person of color will have for an outcome and what a white person, and I'm not saying that is just a Blue Earth County problem or just a Mankato, that's across the nation, we know that. So we have to look at those whole systems. So sometimes I think what's happening is we're seeing people who normally wouldn't be a criminal, they can become criminalized by a system. And so that is a really difficult thing, and that's one thing that we have made a commitment to, is working towards figuring out how do we do that, how do we best serve our community at looking at the systems that are in place to try and correct that and make it much more equitable.
Unless there's more.
There's more. I'll go back to the mental health piece, and over the course of my career, how community-based hospitals were open, there was bed space available, and so when you talk about somebody who becomes a criminal as part of the system, to bring somebody to the hospital for an evaluation and have them leave because they don't meet that criteria, there's not a bed available, then they go back to the streets and there's another call for service later, 2 hours, bring them back to the hospital, they're released, they're brought back to the streets because there's a lack of beds. There's not a perfect or a better recognition that mental health equals medical health. And so just the treatment that would be available, and a lot of it comes down to funding mobile crisis teams. I would love to work in a community where if someone called 911 for a crisis, that a crisis team would go out and not public safety. We don't have that structure in place, so we might be the first call, but we can call that mobile crisis team to come out there with us. But a couple of years ago, as we were using them more and more and our numbers were off the charts with them, their funding was cut. Because it was almost as if you were successful, so now let's share the funding with someone else to try to get them to be successful. And so it's that recognition that the services do need money. I'm not advocating for more money for our budget. I think that the city and the community budgets for us very fairly, and we can accomplish the goals that we have with the funding that we do. But those social service agencies, the mental health crisis teams, the crisis centers, I don't think that our crisis team and our crisis center should cover 10 counties. And they're not alone in that. I think that there are, I don't know the exact number, but there aren't enough. Now, if we could have a crisis center that operated in Blue Earth and Nicollet County, or maybe 3 counties, 4 counties, even better, but to think that they serve people in Rice County, can serve people in Rice County the same way that they would in Blue Earth or Nicollet County is just a strange concept to me. I think it's just a matter of really going back to what's the cause of some of these things and really looking back along the way to find out what that is. And unfortunately, it's going to cost money. And so how do we identify what those issues are in order to better allocate and better problem solve? Because I think that's just going to have a wonderful trickle-down effect for the rest of the community. Our calls for service, it will allow our officers more time to go out and focus on doing engagement and focusing on criminal investigations and being able to prevent crime than having to spend a lot of time transporting people to a hospital or transporting them to a crisis center when there just isn't a bed available.
Appreciate that. I mean, both of you talked about things most people can see, but in that I don't hear any criticism of the Mankato police work or a suggestion that that's an area that we need to focus on. And as far as funding, I'm welcome you up to St. Paul anytime to sit down and talk about where the money comes from, because we have a balanced budget requirement. If you put another $1,000 into one thing, that means you're gonna take it from somewhere else. Turns out people like to argue about that. I was surprised to learn that, but funding's a whole other meeting, series of meetings.
You know, but I do think that what Matt's saying is really, him and I have a lot of the same thoughts on things. And it's not time for law enforcement to make the ask. It's not the time for us to say, we could do more if we had more. It's time to say, put that money, not take away money, but put money towards mental health, put money towards the alcohol and meth addiction and all that is, and look at employment and housing and childcare. Those are the issues that if everybody had some more access, we think we would see very different outcomes on the street.
That's great news from Minnesota, though, because it suggests that where our emphasis should be is not in police officers and how to do their job, but in some of the more structural stuff. So, at least that, psyched to report that. I can't resist one other question, because I assume you guys just want to have you talk for the rest of the day. If we have police departments like we do in Minneapolis, who seem to be facing more questions from their citizens about how they police, what's the difference between Minneapolis and Mankato? Why do you think that area of emphasis, and I guess if you want to put it this way, why are we a little more fortunate?
I have a number of thoughts. One of the things I'll say is we live in a really unique community in Mankato. We're the right size. We're not too big, we're not too small. We're kind of the only game around for quite a ways. And everybody knows everybody. If I sat down with you right now and said, start telling me some things that you do, within 5 names, we would say, oh yeah, that's my friend's son, or something like that. It's really cool because, I don't hide where I live. I'm part of the community, this is my community. So you know people, and you know Matt Rose walking down the street, you see him in the grocery store, but you also see him pulling somebody over for stopping. And so that's, I think, the one thing that we have going for us. Another thing is, I'm a very transparent person. I'm very open, and that's the way Matt and I run the department. To have people approach us, question us, answer the hard questions, have the tough conversations. When we had the protests that were down here right after George Floyd's killing, is Matt and I went out in front of our building and stood there for 2.5 hours and asked questions of the protesters, or answered their questions. And I think it's things like that that people don't expect out of us. But as a community member, when you live here and you love the community as much as we do, that shows through, and that's what our officers are. We're fortunate all of our officers live within 15 minutes of Mankato. I say one, but she's trying to move. So we're close by, we're close knit, our kids go to school together, and I think that's something that we have unique. Where I might see your face and I know right who you are, is you're probably gonna recognize a number of my cops, not for any wrongdoing.
No, of course not.
But it really makes this community different, and I don't think people, I think a lot of local police do have support. I think the media has kind of distorted that, but I do think we enjoy a lot of support here. And if you just looked at the last body camera article in the Free Press, we're talking about buying body cameras. If you look at the actual words in those responses, they were all like, these are great because they protect officers. It wasn't ever we want to catch officers doing something bad. It was all about the positive and how they could help us solve crime better than that. And that's how our community thinks we are. And that is who we are. And when we're not, because we do have bad days, we do make mistakes, and we do have some, sometimes some character issues, is then you call us out. And I will always be happy when my words don't meet my actions, is call me out and call me out publicly.
I'll stop.
One of the things that I recognized last year, a number of us walked with the group during Juneteenth from North Mankato into Mankato, and we weren't walking alongside to stop cars or keep them safe. That was part of it. We were actually walking with the group, inside the group, and the same people that were saying thank you for being here and thank you for walking with us and making a statement are also the same people that would come to our building the next day and do something to hold us accountable. And so to have that moment to think, I work and live in a community that both appreciates us and can hold us accountable all at the same time is somewhat revolutionary. And it's not something that we see across the state and certainly across the country. And so we have people that don't appreciate and just want accountability. And then we have some people that probably just appreciate, and I think more of the community is in the middle, and they could go one way or the other. But they're going to support us and they're going to appreciate us and then knock on our door and tell us that we're doing something wrong, and we'll be there to listen.
This might be a difficult question, but I have a short-tailed relative who left policing, and I don't think this is an exact quote. He got tired of dealing with, the kinds of people that he was dealing with. But he was an officer, it was either in Marshall, Minnesota, or in that county. And then he was Wyoming Highway Patrol. And when he came back here, he just decided he didn't want to be a cop anymore. And I thought, Marshall and Wyoming, what could possibly be that bad?
So there is stuff that's that bad. We see horrible things. We see people at their worst, at struggling, when we talk about mental health crisis. We see accidents. We see kids that are killed. We see abused children. We see really, really horrific things. And we're expected to be strong, don't show emotion, and keep going on about your business, and then go take the next call for service. And as a profession, we have done horribly with our mental health and our well-being. There's another thing that happens, and usually you will see it in a drug task force member, is they're only seeing a certain part of society over and over and over and over. And they forget that's not the norm, but that's their norm in that moment. So one of the things that we have done is we just purchased about a $40,000 program to take care of our officers and firefighters' health and wellness. And that's spiritual, physical, mental, physiological, and financial. It does all 5 things, because we know when we have healthy officers, we have better outcomes. And so that's where while we recognize there are all things we can do here with police reform and things I think that we need to do going forward, is we have to concentrate over here to make sure we have healthy officers to get the good outcomes that we really want to get. But yeah, it is, when you see that same segment of society and you start to, it can really cloud your judgment, and that's where you need to have the time where you have a peer-to-peer support, or somebody to say, hey, you seem a little short, what's going on? And, oh, I'm just getting tired of this and that and the other thing. Okay, well, let's move you to a different assignment, something like that. But I think it would be interesting if you asked him what he saw, because a lot of people don't think we see some of the things that we do.
question. You mentioned that sequence of starting with a speeding ticket that can lead to a much more criminal kind of future for some people. Now that this past year has kind of forced a lot of us to recognize those systemic issues in our society with people of color, how are you guys, and Senator Friends, if you want to speak on this, how are you actively working to interrupt that sequence, to actually do something now that we have seen what kind of plays out here in our society?
There are a number of things. I can talk specifically what we're doing here in Mankato. Because we have a reputation in our community that we do, right after George Floyd's murder, a number of people came to us. NAACP, the Greater Mankato Diversity Council, the YWCA, Beam, Black Excellence around Minnesota, the Minnesota Hip Hop Coalition. They came to us and said, we're here to partner with you. And I mean, that was incredible to have the people who are, felt the most targeted by police reaching out and saying, we're here to help you. And what the stand I took from the very beginning, and I think I said it even in the town hall, was we'll stand beside you and we'll stand behind you, but you need to lead us. Because it hasn't worked, us being the leaders before, right? It has not worked. So that's the goal, is to be able to look at some of those things. We call that group our police committee on our police reform committee, steering committee. And they're a group of about 12 or 14 people who we run ideas through, who we say, is this fair? We had a picture published in the Free Press, and I don't know if anybody remembers it, that there was some flack about it, and they said that picture is of a black man and it's fuzzy, and is this gonna lead to officers stopping black men to see if this is them? Is this gonna lead to people calling in just on black men? So we took that issue to our police reform group. And they sat there and they asked us questions, and we really talked about some guidelines and times to use that insight before we do something. And so that's what we have done. We actually came up with some really good guidelines that I think make it fair all the way around and make it easily for people to understand. But that's where we have to hear is, here's our ordinance, here's our issue. How are you seeing it? That this is unfair or unequitable, and then let's tackle that. So without hearing those insights, we're not gonna get anywhere.
Done this a few times.
One of the ways that we are working on continuing to go and meet people where they are is through this steering committee and the relationships that we've built there, because we recognize that people may not necessarily still want to call the police right now and invite them to a neighborhood party, or to invite them to a meeting such as this, if it's within the communities of color. But yet the steering committee has allowed us to build relationships where those invitations are coming in yet. And so it's come up to the part where we're having a rally, which some may call a protest, but it's a rally, and come stand here with us and talk to the crowd and walk with us. And if we don't have those relationships built, and we can't sustain those relationships, then we're not gonna get those invitations, because we'll try to invite ourselves places. It's awkward showing up to some place that we're not necessarily invited. And so how do we continue to build those relationships to make sure that those invitations come in? Because it is important now more than ever to go and meet people where they are, instead of expecting people to come to the Public Safety Center and come meet with us. And whether it's in Amy's office or in our training room or wherever it happened to be, we have to go where they are. And sometimes that's a park, sometimes it's their front yard, sometimes it's fine, I mean, wherever they are, and we have to be flexible and have that ability to go and meet them where they are.
All right, that looks like it's about it. Thank you so much. Really appreciate it, and I'm hoping to see all of you back for the 27th. Thank you.